Good evening, everyone. Welcome to the Healthier You Show, a guide to living a healthy, active, and productive life. Now, let me turn it over to my co-host, Alana, to tell us a little bit about our special guest, Donna, and what we're going to talk about today.
Hi, thank you so much. We're so happy to be joined by Dr. Donna Spruijt-Metz, who is currently the Director of Mobile and Connected Health Programs at the USC Center for Economic and Social Research. She is also a Adjunct Associate Professor in the Department of Preventative Medicine at the USC Keck School of Medicine. And, as if that wasn't enough, she's also the Director of Responsible Conduct and Research at the USC Keck School of Medicine as well. So thank you so much for joining us.
My pleasure.
Great. So tonight we're actually going to be talking about something called mobile health, and sometimes it may be referred to as mHealth. So kind of just to get us started, can you just kind of give us a basic definition of what we mean by mHealth?
mHealth, or mobile and connected health, is the use of new technologies, wireless technologies, wearable sensors, your smartphone, your smartwatch, to track behaviors and or physiological signals that can help you to maintain your health, or can help you to, for instance, I have an AliveCore monitor, which we'll talk about in a little while, which can help the doctor monitor you from a distance. Also, a lot of mobile health technologies are being used in developing countries to provide access to care where in very rural or remote areas where there are no doctors, but maybe promotoras or their version of promotoras, or people that can help and are connected through wireless technology. So mobile health is really a very large umbrella term for many, many things.
Can you give us some examples of the usage of mobile health?
Sure. So mobile health, let's start from the kind of mobile health that I use. I am a quantified selfer. I like to keep track of my diet, so I use an app called MyFitnessPal, which has a diet app in it, and also can track your physical activity. It's an app on your phone that you can download for free, and you can enter things yourself.
Okay.
So that keeps track of my diet and physical activity, but I'm not always a good self-reporter, so I also I wear this as a step counter. It's a Fitbit. There's a bunch of different ways, and that can keep track of my physical activity, how many steps I take.
Now, Donna, I'm gonna kind of stop you a little bit there. What is a Fitbit?
So a Fitbit, this tracks my steps. It also tracks how many stairs I take. This can also track my sleep.
Ah, interesting.
So if I can wear it on my wrist at night and track my sleep. So there are many, many different kinds. There's the Jawbone Up, there's the Nike Fuel Band, there's the Fitbit, there's many, many of them out on the market. This, for instance, is a Basis watch. This you can track your heart rate with. So eventually, using the right algorithms, we might be able to track stress using a watch like this.
Very interesting.
So that's one way of using mobile technologies and mobile health to track health behavior, sleep, diet, physical activity. But another way that mobile technologies are being used are to communicate important things to your doctor. For instance, there's now, WellDoc has a great a glucose monitor out that can communicate to your doctor in real time. Another thing that you can use mobile technologies for is to intervene in real time. So for instance, one of our interventions was called Know Me Networks, and we had kids wearing an accelerometer or something like this that counted that recorded their physical activity, and it sent it to the phone, and that came up to us on our back end, and we could see if they were sedentary for more than 2 hours, and at that time we would send them a message.
Oh, dear.
Oh, wow.
Yeah.
Keeping those kids accountable.
And another thing you can use your phone for is what's called ecological momentary assessment, EMA, when we are asking you questions about your day. You can use it for health, you can use it to report pain. I can prompt you for questions, or you can decide you want to tell me something. So then there's other sensors and monitors like the AliveCore technologies. This turns my phone into a heart rate monitor. Well, actually, it shows your heartbeats. And that can also be analyzed immediately and also can be sent to a healthcare provider.
Now, has privacy been an issue when it comes to collecting, sharing these data?
Yes. So privacy. I am not an expert in privacy and security. It's a concern. I think that as we get better with hooking up all these mobile health technologies together, which is something we're working on. There's many, many different kinds. Some are proprietary. Some will give you your data. Some won't give you your data. Some data is lower risk than others, like my physical activity data. I don't care if that, but my electronic medical records, I would rather not.
Right.
So, some data is more sensitive than others. Some people are more worried than others about their data. And certainly there's a lot of work in the area of security going on right now.
I see. And now, how long has this technology been on the market, and where are we at in terms of that development process?
That's a really good question. So how long has it been on the market? It's sort of stealth crept up on us. I've been in this field for almost a decade. And back at the beginning of it, technologies were pretty clunky, but we were still using them.
Right.
And the thing, so where is the field today? That's a really good question. The field is in this very interesting space where we've got a bunch of different people interested in it. So there's the consumer, who wants technologies that look good, are easy to wear, are unobtrusive, are secure, and are fail-safe, and are slick. They want all those things. But they also want different things. So children, the kids I work with, want different feedback than the adults that I work with, for instance. So that's the consumer. Then you've got the scientists who want to make sure that things are actually valid, that things actually do what they say they're going to do. And then you've got industry who wants to make things that sell. And getting these three players together in a room and having that actually really work is the problem that we're working on right now, because there are many apps out there that none of them have been validated or have been, so do they really work? Do they do what we need them to do? There's some really interesting technologies like for gait detection in the elderly to make sure that they don't fall, or to be able to predict falls. We've been using real-time monitoring to be able to predict health events later down the road. For that sort of really life or death situation, your technology needs to work. It needs to be valid. It needs to be tried and true. We need to do research on it first before it goes to the market. That's not always happening.
I see. Very interesting.
So getting those three together in one room and having them work together, I think, is the most important thing in mobile health right now.
So what are those technologies, apps that are currently out there that maybe have been validated that you would actually recommend maybe to a consumer? Say somebody's they're maybe overweight and they want to kind of maybe identify a good app that would assist them in that health behavior change. Is there anything you would recommend to them, or?
There are a number of things I would recommend, but that doesn't necessarily mean that they've been well researched or validated. Some of them have been, many of them have not. But when it comes to overweight and obesity, which is, by the way, my field, what we know is that self-monitoring of your behavior is a powerful intervention in and of itself. So if you can get yourself a Withings or the ARIA scales that are Bluetooth enabled, so I don't know if you've seen those, but they keep track of your weight, they calculate your body fat and BMI, and they send it to your phone. And then so you can keep track of that on your phone. And then keeping track of your steps or your physical activity really can help you change your behavior. The thing about monitoring your weight, it helps you lose weight. We've seen it a million times. If you can keep self-monitoring. Then a thing of the Withings and the ARIA scale talk, for instance, to the Fitbit. So the Fitbit, then on the dashboard on your phone, you can download an app that belongs to the Fitbit, or you can go online, and it calculates. If you tell it what your ideal weight is and what your actual weight is, and you tell it what you eat, it'll let you know how many calories you have left in the day and how much exercise you need to get to get where you're going. So MyFitnessPal is another one that's really excellent and also communicates with other apps. Runkeeper communicates also with Fitbit. There's a Nike Fuel Band is a good, if it depends on what you like as a reward.
Right.
So the Jawbone Up is nice. They're coming out with new ones every day. So it really.
And we'll make sure to be posting some of that information up on our website. So the viewers at home, if you're interested in some of these applications that you hear Dr. Spruijt-Metz talking about, you'll be able to kind of look them up and kind of evaluate them for yourself.
If you'd like that, I can give you some great links. Recently, some evaluations came out that are publicly available and really nicely done. I can give you those links.
That'd be wonderful, absolutely.
That's great. We were just talking about some of your research focus. What are you focusing on? What are your fields of some of the projects that you're working on now?
Oh, I love that question. So my work is in childhood obesity predominantly. So the project, so Know Me Networks, the one about getting kids to be less sedentary, that was a great one. That was fun. Big project right now is called Virtual Sprouts, which is a mobile gardening game to teach 3rd to 5th grade children and their families about gardening and healthy cooking and healthy eating. That's an ongoing project right now. Another one is using socially assistive robots to help overweight kids exercise.
That sounds very interesting.
Yeah, overweight kids often don't like to exercise in group, and maybe not with other humans, but a socially assistive robot, we have these cute little robots there, just darling. And that might be a way to get kids more interested in physical activity.
Are these robots available on the market already?
No. This is very, they're available on the market, but they're not affordable. I mean, we're looking first to see if this can actually work, and if it can, then we'll move towards, maybe working with a company to make something affordable.
Right. You also mentioned about the mobile app that teaches kids with gardening, virtual gardening tools. So tell us a little bit more about that.
So that one that's a great project. So it's based on another project called LA Sprouts that was actually putting gardens in schools.
Oh, okay.
We're just finishing up that program, and we really saw loss of weight, better eating habits, all sorts of really great, actually better metabolic health in the kids that were in the gardening program as opposed to the kids who were not. But it was very difficult to get the gardens into the schools. So we thought, how can we get this accessible for everyone? We thought, how about making a game that you can have on your tablet or on your phone? And that you can, so what we've done so far is we've used recipes that were developed in LA Sprouts that we know kids like, that we know they can grow some of those vegetables in their rooftop gardens or on the ledge of in their kitchen. So not necessarily having a full community garden. And we've got the recipes, we've got some teaching development to do, and we're going to try it out in about 3 weeks in one of the schools in LA County.
And where are these gardens taking place?
Well, the gardens for Virtual Sprouts are on your tablet, but we teach you, that you can grow stuff on your rooftop garden or in your kitchen or in a community garden. So that's the idea. And the thing about mobile gaming is, first of all, it's motivating. Second of all, what we're hoping to do in a future iteration, right now we're just developing the game, but if I can give you an accelerometer or a step counter that communicates with the game, then I can know what motivates you and what, if you're being more active because of the game. We can get mobile technologies working together with the game. And another great thing about this kind of using games for education, so for teaching, is that really, if you do the back end of the game right, you don't have to test your kids, because you can tell by the way that they navigate the game what they're learning and what they still need to learn.
Oh, interesting.
So where are you piloting these programs that you said, because you mentioned
in
about
a school
in the school.
In Los
so
Angeles.
what school?
I can't tell you that.
Okay, it makes sense. Okay, I think that was my earlier
fine.
question, trying to figure out. So if we're piloting this program, where are they kind of taking place, and how?
Los Angeles.
Okay, good to know. That's good to know.
Yeah.
So for the Virtual Sprouts program, I guess one of my questions is, what's the actual age range?
3rd to 5th grade.
3rd to 5th grade, and teaching about recipes and cooking. How are families and parents integrated?
We have some materials for them. So you bring up a really good point. And one of the I'm not even sure I'm supposed to tell you this, but I will tell you.
It's okay. We won't tell. We'll keep it a secret.
So one of the projects that I'm trying to get funded is doing a family study. So what we want to do is we want to wire up the houses of families. So for instance, there's this new physical activity sensors out that actually sense one another, and your phone can sense each other too.
Right.
And so what we want to know is, what kids are eating in the proximity of whom in the house, and what kind of tensions go in, because we know that tension during mealtime leads to really bad eating habits, and so we want to see how that environment, the home environment, plays into how children eat, and then if we can change that using something like a virtual Sprouts game. But so there are family materials for it, and we hope to build out the game to include family, but that would take a next cycle of funding. But it is really super important, especially because we're working mostly with Hispanic and Latino families, and those families are tight-knit, and so we really need to reach out to not just the children but to the families, but we're starting with the kids.
So no, in terms of reaching out to Latino communities and children, and what are some of the challenges and what are some of the engagement protocols that have already been proven successful?
So in the field of mobile health, it's a new field. So proven successful, I mean, we've had some success. Colleagues of mine have had some great success in the African American community in Chicago. So we've had some, NOMI networks had some success. They've all been small. But when you ask about what's been tried and true in the Latino community for obesity, I think the Salute program has had some, it has a lot of followers. It hasn't been tested.
So tell me a little bit about the Salute program.
That's not my program, but I can give you the website.
Okay.
Sure.
So we'll put the website out there.
There's a number of places that are very good at reaching out to provide information. We've had a couple of really successful interventions before using mobile technologies, which kind of led to using mobile technologies for me. One of them was called Sano LA, where we brought kids in and to our lab and actually gave them cooking classes. We did physical activity with them. We took them out and went shopping with the families to show them what in their stores where the healthier foods were. And that was a pretty successful program.
Very interesting. And how long was that program?
It was a 16-week program.
16-week program. Very interesting.
Yeah.
Let's go back to working with Latino communities. Yeah. And what are some of the challenges that we have?
Well, I don't speak Spanish, but I'm surrounded by a great staff who do speak Spanish. I think one of the challenges working with children in Hispanic communities is that whenever you work with children, whether or not you've got a family component or not, the family is involved because they've got to, get the child there. Even if you pick them up, they've got to know about it. And these families are working 2 and 3 jobs. So that's a huge challenge. You have to know when you reach out to any population, what are especially in obesity, what are the activity habits? What do they like to do? What don't they like to do? In some of the Hispanic communities, not all of them, but in some of them, a physically active female is not necessarily acceptable. A really active female may not, that there are still some gender role differences. That's not in all the communities. Access to healthy foods is a huge problem for some of the communities. I think one of the really interesting things that we've run into is the sort of eating for two phenomena, that they're eating their cultural traditional foods at home and then sort of eating the bad American foods outside of home, fast foods, that sort of stuff. But then they sort of eat them both, so they end up eating really a lot.
I see. What are some of the things whether they could do to help to overcome that challenge or to create that a cultural environment of health?
Traditional foods are good, often very healthy, healthier than the American fast foods. So, but there's kind of a fairly simple formula that's pretty hard to adhere to. And that's why mobile technologies are so great, because you can keep track of what you're doing. So the magic things to do are eat more fruit and certainly more vegetables. Try to get rid of sugar in your diet. Sugar is everywhere, so read the labels. There's some great food scanners that you can download on your smartphone that will tell you what's in there, and there's also some sugar alert ones. So for instance, anything that's got in the first or the second or the third ingredient on the back, and when you read those labels, if it says sugar is one of those ingredients, like ketchup, you don't want to buy that ketchup. because it's mostly sugar.
I know.
So get another one that doesn't have
Right.
sugar as one of the top 3 ingredients, right?
But sometimes we also notice that the price tag on these healthy, quote unquote, healthier products are slightly higher. So for the communities out there who might not necessarily have the appropriate resource, what are some of the alternatives out there for them?
So I said eat fruits and vegetables. I didn't say eat organic fruits and vegetables. Eat fruits and vegetables if you can afford organic, great, but just make sure you wash your fruits and vegetables really well. You know, for some of them, you know, it's better to wash them and eat the peel because a lot of the peel is healthy. There's some great, there's another great app on here on my phone called Seafood Watch that tells you which seafood is safe to eat when, because that changes because of, you know, because seafood, good food. Seafood is good food.
Right.
Don't fry it. Another really important thing to do to stay healthy is to stay active, physically active. For children, an hour a day at least of moderate to vigorous physical activity. And the kids in our studies are getting 3 to 4 minutes today of vigorous and maybe 20 of moderate. And for you adults out there, 30 minutes a day, yeah? And you can do that. You can find out what you're doing and keep track of it using these very simple trackers that are not necessarily super expensive.
And how much do they usually
Though
go for?
So Fitbit has one out that's $59. There's some cheaper ones out there. The Omron has a little pedometer that just counts your steps. Some of those are $20. There's one that I give away sometimes for my studies. Fit for Life, I think it's called, and they're like $6. So it's doable. There's so many great trends, and many of the health apps. Once you have a smartphone, an Android or an Apple, they're free. So you can just download them. But remember, one of the important things I said is most apps are not validated. Some of the fitness wearables that you can get are not necessarily accurate, but they do great for motivation, and self-monitoring really does make a difference.
Yeah, and I think also with kind of mobile health technologies, I think obviously we were saying like the price point for a lot of these things is very low, it's very accessible. Cell phones are they span all demographics and socioeconomic levels. I mean, I know that there's about, at one point I read in 2010, there's about 258 million cell phone subscribers, so everyone has one, which is great. So I guess also just looking at different health interventions are out there, I mean, why is really mobile health maybe the wave of the future, and we're really kind of looking, what kind of advantages does it really offer?
So many advantages. So what is health all about unless you're dealt a really bad hand of cards in your life? Health is often about your behavior as a human being. And so one of the things that healthcare providers are doing all the time is trying to get you to change your behavior, to eat better, but also to adhere to medical treatment, right? So there's something called the MEMS cap. It's fabulous. It knows every time you open it. And so your doctor and that data can go to your doctor, and your doctor can then know if you've taken your medicines. So there's a lot of mobile technologies like the glucose meter that can give your doctor information that they need on an ongoing basis, so that if they see that there's an emergency, they can get to you now instead of much later. And it really, another thing about mobile technologies is that we're getting data continuously. Now, what is continuous data? So we used to get data about you. We used to find out about you maybe when we asked you a question, or you fill in a questionnaire. And that's like a one-off. But with this, I can know, in combination with this, for instance, I can know what time I was active, how much activity, where I was, who I was with. I can find out all these things about human behavior. I can know, for instance, there's a great mobile health intervention by one of my colleagues, Dave Gustafson, for recovered drug addicts. And he uses a GPS so that can locate you in place.
Very interesting.
So this has a GPS in it, knows where you are.
Right.
But he uses a wearable, or maybe the phone. And if you as a recovered addict are near the park where you used to buy your drugs, which he'll know, your avatar therapist comes up on your cell phone.
Oh, wow.
And says, hey, you're near the park where you used to take your drugs. don't go into that park. You can stay on the
Wow.
stay
That
on
is
the subway.
scary.
You're on the straight and
Just
narrow,
looking
though.
into the future.
Stay on the subway, and this is turns out to be a great
Mhm.
help. You know, and if you actually do get off the subway near that park,
Right.
then your avatar app will say, "Would you like me to call your real therapist right now?"
Wow.
Yeah. So it's the possibility of understanding behavior in real time and in context is, I think, going to improve the health of a nation, but the health of the world. I mean, also just giving access to developing countries who can now, call the doctor, or say, "I've got, what do I do now?" and show you the picture of the wound.
Yeah.
So it's just going to revolutionize the way that we think of health and medicine.
So I guess that also brings another question, kind of as we're looking to the future and how mobile health is really going to be integrated, maybe into your doctor's visit. So you could conceivably maybe see I go into the doctor's office, maybe I have high cholesterol, so he may prescribe some type of preventative medicine, but he also be like, and now I also want you to also almost prescribe an app or something to really, I mean, do you see that maybe kind of seeing
absolutely. Absolutely. I think, I'm seeing it in very small, incrementally right now. I mean, how many people out there email with their doctor?
Right.
It's happening now. Electronic medical records are going to be real time.
Mm-hmm.
So that and one of the difficult things using all this data is knowing how to give the provider and the patient and the participant the data that they need and want, because it's so much data and it has to be crunched and it has to be available. So that's kind of where the field is now, deciding, the doctors are all going, "Oh, I see all of this information coming towards me, and what do I do with all that? And to what extent am I liable now if I have to know about you when you're no longer in my office?" So, there's a lot of hurdles to come, a lot of ethical issues, a lot of legal issues. Security is an issue, but it's coming. So.
Yeah. With the rollout of with the rollout of Affordable Care Act, how would that impact the future mobile health technology?
I don't know that it does. I see mobile health technologies as the wave of the now, and I don't know that they're stoppable, and I don't think they should be. I mean, I think it's going to lead to much better, more creative, more accessible care for all, because it's accessible to all.
Right. Very interesting. I think Alana is probably going to conclude. Ask her, some of the questions that she's had in the whole show.
Yeah, well, no, I just really appreciate you taking the time, and this has been, I hope for everybody, that's been viewing out there, it's been pretty enlightening. I mean, just all these different kind of things that are coming down the pipeline, I think it's incredible, and I think one of the really exciting things is going to get people engaged in their own health, which is so vital. I'm assuming you would agree, right, to get people to change their health behaviors. So I kind of would throw it back to you. Do you have any concluding remarks about, looking to the future? What makes you excited for tomorrow? What it brings to you?
Oh, what it brings to me as a scientist is the opportunity to really understand human behavior in context and in real time, and then to be able to see where the levers are. So I give this talk where I talk about how I love dark chocolate, and I talk about how much I want chocolate.
I'm there with you, Donna.
How much do I want chocolate? Is it near me? Am I stressed? Is my friend around who I always eat chocolate with? All of these things sort of combine to make human behavior. And by understanding adherence, stress, sleep, what really influences physical activity, what really matters in diet, we'll be able to really change the way that we deliver health care and change the way that we take care of ourselves, pulling the bodies out of the river upstream so that they don't get sick.
You're so absolutely right, Donna. Thank you so much for sharing with us your expertise and experience. Thank you. And for the audience watching, thank you so much for tuning in. You're watching The Healthier You.